Ladies and gentlemen, welcome back to another iteration of Boondock Medicine. Hope everybody's doing okay out there. It's a bit cold. I know you folks in the Midwest are getting smoked with snow and wind and all that kind of stuff. Try to stay warm. Today we're going to talk about eczema fairly quickly. Eczema affects a lot of people in the United States, like 1 out of 5 people actually. So we're going to take a quick look at eczema and take a look at the supplements and a couple of the herbal remedies to mitigate eczema. Now, remember that when we go into herbal remedies, those aren't the only ones. In all the videos, there are more than one. You have to do the research and figure out which one you like the best. But for my money, I like the ones that we produce on this show. So, but you can do what you want to. Do the research, do the work. Okay, eczema. They're red, itchy, sometimes weepy patches of skin. You know what they are. The scratching worsens them. The patches can become scaly, thickened, and sometimes infected. You most likely have eczema if you have these things. The medical term is atopic dermatitis, and doctors don't really know the precise role allergies plays in these conditions, although eczema seems to occur with other allergies like asthma and hay fever. Before we get into treatments, a word about the largest organ of your body. Yes, ladies and gentlemen, your skin is an organ, and we don't treat it very well. First of all, y'all take too many baths and showers. You are depleting your skin's natural oils. There are only a few parts of your body that actually need soap, and you know which ones they are. So make sure you use mild soap. Okay, don't use something that looks like detergent. Eczema is generally a dry skin condition, so hydrate your skin with lotions or creams, especially after you get out of the bath or the shower. And avoid products with alcohol, synthetic fragrances, or lanolin. And everybody thinks lanolin is great for your skin. It's not. Use products that incorporate skin-soothing herbs instead. Finally, when you're done bathing, everybody wants to rub. You know, they want to rub their skin dry. Don't do that. Pat your skin dry. You've got to take care of your skin. It is the largest organ in your body. Okay? Pat yourself dry after a shower or getting out of the tub. All right, let's take a look at the supplements real quick. Biotin. You can take biotin, 300 milligrams per day. Easy stuff. You can get into GNC. Almost all this stuff you can get at any GMC or any health food store. Some of it you can get at Walmart, Target, any of those places. Just make sure that they're the correct dosage. Magnesium. I take magnesium every day, as you know, 200 to 500 milligrams per day. B-complex is great. You got to make sure you take it with food, though. 50 to 100 milligrams 3 times a day. Vitamin B3, 100 milligrams 3 times a day. B6, 2 milligrams per day. B12 is great at 200 milligrams per day. Vitamin E, 200 and 400 international units per day. And zinc, 50 milligrams per day. All those supplements you can take with no problem. Your doctor will have no problem with them either. I don't think. Unless you're taking a medication that is counterindicated with any of these vitamins or supplements. You can check with your doctor. Herbal remedies. Licorice. Most people like licorice. We're talking about real licorice. We're talking about the black licorice. This herb has potent anti-inflammatory properties and acts similarly to corticosteroids, but without the negative side effects of those drugs. Typical dose is 400 to 500 milligram capsules twice a day. With licorice, don't take internally for more than 6 weeks. Don't use it if you're pregnant or have high blood pressure, heart or liver disease, diabetes, or kidney disease. Okay? Burdock. Burdock is good stuff. Burdock, herbalists consider this is the traditional remedy for many skin disorders, including eczema. It's rich in minerals. Burdock contains inulin, which stimulates the immune pathway to destroy skin bacteria that can worsen eczema, like Staphylococcus aureus and Staph aureus and that sort of thing. The typical dosage is 400 to 500 milligram capsules 3 times a day, or 10 to 5 drops of tincture 3 times a day. And remember, you put that under your tongue, or you can dilute it in a liquid. And avocado. Avocado is a good food because it contains vitamins A, D, and E. The same vitamins make avocado good for the skin. To help reduce itching, dryness, and inflammation, apply the mashed fruit directly to your patches of eczema. Believe it or not, smash it up. If you don't have a mortar and pestle, that's cool. Mortar and pestles help in these cases, especially if you're going to take herbal medications. So sometimes you have to smash them up. But mash that fruit up. It's actually a fruit. It's it's not a vegetable. And apply it directly to your skin. It works great. But if green's not your color, you can apply the oil, the avocado oil. It comes in oil also. That's it for eczema. Again, do your homework. There are more treatments for eczema than the 3 I've listed. And everybody's different, so you have to make sure the one you pick works for you. Try all of them. If one works best, stick with it. All right, this is Doc signing off. Stay tuned for another edition of Boondock Medicine, AMF.